Dr. Miriam Graham from Restore Motion Physical Therapy. I'm going to show you how to use a foam roller to improve muscle and tissue flexibility at your adductor region or the inner thigh. The adductor muscle group attaches to the pubic bone in front. This is the pubic bone. Along this area and down to the inner part of your thigh. So we're going to use the foam roller. I'm going to turn over onto my abdomen and I'm going to start right up by the area where my leg and my pelvis meet, by the pubic area. And the foam roller is perpendicular to the fibers of the muscle. And from here, I'm just going to do a little bit of rolling over the foam roller to try to release those muscles. I'm taking the roller, or the muscle rather, in thirds. So this is my top third of the adductor group towards the pubic area. And then I'm going to move the roller down to the middle third of the muscle. So along the middle third of the adductor muscle group, there are several of them. We're just trying to gently roll them out. And then I'm going to move the roller over so that now I'm at the distal third of the adductor muscle group, using my body weight to gently roll the area, improve mobility of the fascial layers. If I find an area that is particularly interesting, maybe there's a little trigger point or a little bit of tightness there, I can kind of focus on that and I can add a little bit of internal rotation with my lower leg to address that area specifically and help release that area of tightness or inflexibility. So that's using a foam roller to roll out your adductors.